Today, let's talk about some very important things that relate to the quality of care that we provide here at Oswego Community Hospital. Let's talk about the way we communicate with our patients and our coworkers and the people in the community, and how respect and information are very much a part of that communication process. Too often we underestimate the power of a touch, a smile, a kind word, a listening ear, all of which have the potential to turn a life around. That's what we can do with the power of touch. Did you ever say, or maybe you heard someone say, "I can't do that. I would, but no, there's no policy." Or the administrator says this, or "It's not my job. It's not my problem. We're too short-staffed. We can't do that. I can't believe they kept you waiting so long. No one ever told me you were here. You're not my patient." Did you ever say those? We know what our patients, what our clients want from us. Respect. They want to know that they can trust us, understand how long it takes to get a certain procedure or project done, and to understand what's going on, and then respect again. The reality is, this isn't rocket science. This isn't complex. And it's not something we should do sometimes. We shouldn't just do it usually, but we should do this always and with everyone. Today we're going to talk about AIDET. It's a framework of communication, the way we communicate. And we can use this with patients, with family and members, even one another here as coworkers. It reduces anxiety and can improve the perception of the care and the service we provide. When we decrease anxiety and we increase compliance, we have an improved satisfaction that's bound to happen. Why should we use this with patients? It reduces the patient and family anxiety by establishing trust. It improves compliance for better outcomes because patients will cooperate more readily with their plan of care as a result of that trust. Clear communication creates a safe environment to receive care. AIDET helps us to build customer loyalty, and we all want to be their preferred healthcare provider. Why should we use this with coworkers? First, it reduces a coworker's anxiety about whether or not they can count on us by establishing trust. It improves teamwork because colleagues will cooperate more readily with you as a result of that trust. Clear communication creates a more effective, helpful, and healthier environment to work in. AIDET helps us to build loyalty for one another. We want to feel good about the people we work with and for. AIDET. Acknowledge, introduce, duration, explanation, and thank you. When we acknowledge, it builds safety and respect. When we introduce, it decreases anxiety. When we spend time with the person, duration, it increases cooperation. When we give an explanation, it improves the overall quality. And we end up with a simple thank you. It proves value and respect. So, how do we acknowledge? We make eye contact with a smile when we walk in the room. It always lets you connect with your patients and the providers. It shows that you care, and we acknowledge all the people in the room. It addresses patients by name, assisting in identifying patients that shows respect and courtesy. For example, "Good morning, Miss Elizabeth." That makes them feel important and cared about. You only get one chance to make a first impression. Introduce. Introduce yourself and your role to the patient and your family. On your first contact, "My name is," "I am your," "I will be caring for you today." Cite your relevant experience and expertise. How long have you been doing this? What are your qualifications? Patients may not know who you are. Uniforms are not identifiable amongst the patients. And the small town argument that everybody knows everybody isn't really true. It's important to be personable and warm. Managing up. We can introduce other workers within other units within our hospital or other hospitals within Empower. For example, I'm the RN on this afternoon, but I am also working with Sally, who is the Director of Nursing. She may also be in and out to help with your care. We should always be willing to manage up. We should never want to manage down. We should never be saying, that's not my job. Duration. Patients and family feel less anxious if they are aware of the timing of what is happening. Where possible, offer an expected time frame. However, ensure that the time frame is achievable and reasonable. Overestimate, don't underestimate. We expect to have your test results by mid-afternoon or tomorrow around 11. You'll be having a example. It is not the wait that gets people upset. It is not knowing why or how long. And it's always good to provide regular updates so the person knows that they're not forgotten. Explanation. Inform the patient and the family in words they'll understand. Keep it simple, keep it straightforward. Explain what they should expect and what is the plan, treatment, or the care that's being provided. And it's a good rule to keep that within 2 minutes so that we don't lose the patient. This will empower the patient, it sets realistic expectations, it reduces anxiety, and increases compliance with the treatment and the plan. AIDET is explanation. Explain it in ways that it can be understood. Explain who will be involved in the procedures. Explain some possible side effects. Offer answers to any questions, and invite the patient to be involved in and understand their care. We would always want to say, now, what questions do you have? A negative comment would be, do you have any questions? And please, please don't ever say, you don't have any questions, do you? We need to get the A and the I right to get a better outcome with the D and the E. And end with a thank you. End the interaction respectfully with a closing comment. Thank you for your time. Thank you for waiting patiently today. Good luck with everything. Take care. A positive statement and respectful. AIDET, thank you. Thank you for trusting our hospital. Any other assistance you might need? Is there anything I can follow up with? Share your appreciation for the privilege of caring for your customers. Thank that customer or that patient for choosing a hospital for their needs. For example, thank you for entrusting us with the care of your mother. We really enjoyed getting to take care of her. Thank you for allowing me to care for you. Is there anything else I can do for you? I have the time. The purpose of the health system is caring for patients. It is their health system, their hospital, staffs, and services. They too will respond with respect if that is their experience. That's from Commissioner Peter Garling, the Australian Health System. So, let's practice. What would be your script for acknowledge? What would be your script when you want to introduce yourself? How would you work duration? What would be something you would say? If you're going to explain the program or a procedure for someone, what would you say? What's your script? And a thank you.